Hello and welcome to today's episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr, and today we are talking about organ and tissue donation. This is going to be a really powerful episode that's going to provide some very necessary information for you and probably someone you love. Stay tuned. Paula, thank you for joining me on today's episode of Community Connections.
Thank you for the invitation, Anna. It's a pleasure to be here.
Now, you are here on behalf of LifeSource. For people that are not familiar with the work of LifeSource, can you just kind of give us a brief introduction on the nature of you guys' work?
Yeah, LifeSource is a nonprofit organization, a medical nonprofit organization, federally designated to manage all the process of organ, eye, and tissue donation. We're over 200 people working for LifeSource. We service 3 states, Minnesota, North Dakota, and South Dakota. And our medical team has been working on saving lives for over 35 years now, and we also honor all those people who have decided to register as an organ donor.
You all are located right here in the Twin Cities, not too far from us here, right off the amazing Mississippi River.
Yes.
Such a picturesque area of the city.
Yes.
You all have such access to so many different populations, so it's so important to have you joining us today to talk about organ and tissue donation. Now, personally, I am well aware of organ donation, but for those that may not be familiar, can you talk about the work around organ donation and tissue donation?
Yes, well, you know, for a lot of communities, it's still a myth, or they don't know too much about it. But what I can tell you is that this work is just a gift, is the most amazing and precious gift a human being can give to another human being. It's a very complex process. It needs to happen in a hospital. It needs to happen when somebody is passing away in a hospital. The person needs to be on ventilated support. And I want to be very clear here because there is a lot of misconceptions about the process of it. So if you pass away in your house, if you die in a car accident, for example, you are not eligible to donate your organs. It doesn't matter if you're a registered organ donor already.
Okay.
That cannot happen because the process is very complex. So you need to pass away in a hospital, being on ventilated support, to be able to donate.
I think that's very important, and that's something that I didn't know. So I'm grateful to have you here and share some of the real life information. You were saying that even if it is listed on your identification card that you do want to donate your organ, you are not a viable candidate.
If you pass away in your house or in another place that is not a hospital, you cannot donate your organs. You need to pass away in the hospital, and you need to be on ventilated support to be able to give those gifts to another person.
Now, I currently have a note in front of me here that says that 37 million, or 1 in 7 United States adults, are estimated to have chronic kidney disease. And if kidney disease progresses to kidney failure, a transplant is usually the preferred treatment option. But there is a shortage of kidney donors here in the United States.
Yeah.
Can you talk to us a little bit about that? Because those are pretty high odds. 37 million people just here within the United States.
Yeah, correct. And actually there are over 100,000 people on the waiting list to receive an organ. And most of those 100,000 people need a kidney. And what is even more complex is that a lot of those population are diverse populations. So a lot of African Americans, a lot of Native Americans, any type of diverse person is higher in the waiting list. And the problem is that we're not registering to be donors in comparison with white people, for example. So we need more organs to be transplanted, but we're not registering to be donors in the same percentage.
Now, you talked about registration for donorship. What is that process typically like if you were interested in doing something like that, so we can start to close that gap on 37 million?
Yeah. So what we're doing right now to start closing that gap is to be working with communities to provide some information, to provide facts about what organ donation is. So being here with you is an amazing opportunity for us to connect with the Oromo population and East African population and talk a little bit about that. There are things we can do. Actually, you mentioned that our offices are in North Minneapolis, and we were very purposely, when we decided to move to North Minneapolis about 10 years ago, because it's a very diverse community. North Minneapolis is the most diverse community in Minnesota, so we decided that we needed to be in community, to become part of the community and learn from the community. So they see us, right? So we are part of that. So what we're doing is connecting with communities, and how you can register is very simple. When you go and get your driver license, you can decide to be a donor. When you renew your driver license, you said, yes, I want to be a donor. You can register in our website. It's very simple. It takes like 2 minutes to complete that. In Minnesota, we have an option of doing it in the fishing and hunting licenses, and also in the medical app. So those are the easiest way to register. But the main thing we're trying to do is, as you said, to try to close that gap, is being in community, participating in community events, being in interviews with you, for example, and educate people about what is organ donation.
Now, you are here as the community engagement liaison for LifeSource. Talk to me about some of the strategies that you all have in place to engage minority communities in organ and tissue donation.
So we've been working, I'm pretty new to the organization, but the organization has been working with diverse communities for about 2 decades. And we've created a few programs to connect with diverse communities. And one of those, to engage the African American community some time ago, there was this program called Barbershop Conversations. We know that barbers are very important in the African American community. They're very trusted. So LifeSource, in partnership with Southside community, we trained these barbers who had their businesses in Black neighborhoods, so they could learn about the organ donation process, and they could talk to their customers about health issues and organ donation. We have also partnered with Hennepin County Medical Center on a program called Talk Donation with our Native American communities. There are some members of the community that have a great reach out in their communities, so we were able to partner with them. They recorded some videos about why it was important for them to donate their organs, so to start these conversations. And it's something that we are going to be doing again. We got another grant in partnership with the National Institute of Health, and we rename the program a little, and we call it All Relatives Talk Organ Donation. So we've been partnering with a couple of Native American tribes in North Dakota. It's been very successful. They passed a law that they were to get the organ designation in their tribal IDs, and now we want to move that very successful program to Minnesota. We also participate in many community events to try to connect with communities, and we were with Brian Coyle Community Center here in Cedar Riverside, which is an amazing event to connect with the Somali and Oromo population there.
I think it's so important that you are reaching so many underserved communities with this information. We know that indigenous communities often don't have proper health care or spaces to where they have access mainstream like a HCMC or like a Mayo Clinic. So for them to be able to still hear about organ and tissue donation in connection with you all, and you all to be able to provide resources directly, boots on the ground, to them is really essential.
Yeah.
You talked about attending, having the barbershop conversations. That's such an important conversation, but also a place where, like you said, essential conversations take place in multiple communities. And in the African American community, it is very pivotal. I remember being very young myself, going into the hair salon and going to the barbershop with my dad and listening to them talk about about everything from sports to politics to family to relationships.
Right.
But oftentimes conversations weren't taking place around healthcare.
Yeah.
And I know that there were some organizations that were using that time during COVID to discuss whether you were going to be immunized or not, and what was long COVID symptoms like and things like that. So these are really important areas in communities to have conversations, continue and begin conversations around much needed essential healthcare plans.
Exactly, and that's one of our goals, to meet with leaders of the community. Barbers, again, are very trusted, right? And we want to also meet with other leaders who are respected in the community, who have voices, like religious leaders, community leaders, and work with them and listen to what they have to say in representation of the community, so we can listen to what they have to say and how we can work together. Because at the end, this is a partnership. And what we want to do is to reduce that wait list, right? We don't want anybody to die waiting for an organ transplant. And the way to do that is providing education to communities so they understand what it is, understand the process, and how important it is that we register. And we close the gap. We work together with partners. That's the only way to be in community, to work with communities helping other communities.
Now, what ways has LifeSource already connected with some local leaders about organ and tissue donation?
Well, as I told you, with the barbershop initiative, right? Also with the new All Relative Talk organ donation. So we're going to be presenting with the St. Paul Indian Affairs next week.
Okay.
We have also been connecting with Brian Coyle Community Center, which is part of Pillsbury United Communities. So we also work with Way House and provide education and resources in all the community events or health fairs. So we are there. We are also trying to diversify our staff. So we represent the communities in the states we serve. So communities see us represented in our staff. So we are doing a pretty good job, but still we need to increase a little bit more of representation. So just talking to communities and listen to what they say about organ donation and try to just demystify some misconceptions about it is also important. We understand there are some religious beliefs and cultural beliefs that are important for communities, and we're very respectful of that. Our job is just to provide information so people can make informed decisions about becoming an organ donor or not.
Now, you've talked about some existing partnerships that LifeSource has to connect with some of these communities, and you're saying that you all are open. LifeSource is directly open to connecting with faith leaders and maybe some more civic leaders about passing along this very important information. What ways would people be able to contact you all to start having that conversation or further that conversation?
When we are in community, we network a lot with other professionals, so we get invitations to participate in events or provide education. People, through this interview, they can definitely just call me directly. Probably you can post my number later in the program, or my contact information, my email information. We are open to go and talk donation to anybody who is interested in learning a little bit more. Again, education is powerful, so we need to educate communities about this. We are definitely willing to provide information. We have a space that you are very familiar with. You went there. A beautiful space. We have a room that is open to organizations who need a meeting space, and is a good way of connecting with us as well.
Now, what efforts has LifeSource created to ensure that organ donation and tissue donation materials are linguistically diversified to the communities? Because we've talked about so many different areas you all are connecting with, but we know English is not a first language for a lot of people.
Exactly. It's not my first language either, so I totally understand that. We've made a good effort of being very culturally responsive. So in the graphic designs, we pay attention that it represents the different communities. We have also translated some of our information in our website, mainly to Spanish, but we're working on translating to more languages. we created a very neat stickers in many different languages representing the different communities in the states we service. And it says, donation, it's your legacy. And that is translated into different languages spoken here. So we are very aware that we need to be sensitive about other cultures and their languages and what they believe in. So not only in the language, but also graphically.
I think that's really important, and we know that representation matters. So to have something broken down in your language and for you to be able to pass those materials on will help further the cause.
Yeah, and I would like to add that, as you very well said, representation matters. And when an immigrant is another person of colors working for an organization, that opens the door a little bit more, I don't know if faster, but a little easier. That is one immigrant to another immigrant talking about this very serious topic that is organ donation. So you have that additional connection, right? We know, oh, English is not my first language, it's not your first language either, so we can definitely connect a little better.
And I'm sure it just makes someone a little bit more at ease, because this is such a sensitive topic for some people.
Yeah, absolutely. Yeah, and we try to be very respectful. You know, I talk to Sarah and my coworkers, and my coworker Beatrice, who does the same job as I do. Sometimes people come when we're in community events or in health fairs. People come to us and say, "Oh, so what is LifeSource?" So we say, "Oh, yeah, we are the organization that manages all the process of organ donation." And so, "Oh, it's an organ donation? No, I don't know."
Right.
Yeah. So we said, "Oh, why are you a little reluctant? Tell me." So we try to engage in conversation and again, provide some education in all type of events we attend.
Are there plans to increase potential donor support or offer info sessions in minority neighborhoods?
Yeah, absolutely. That's part of my job. And my coworkers, Beatrice's, we are in charge of being in community, talking to community, listen to community. We've been working a lot with Latinos. I'm a Latina, so that's amazing that I have the chance to work with them. But also with other communities that I mentioned, right? We're trying really to work more closely with Native Americans, African Americans, East Africans, and also Asians that are part of the population in our states. So definitely being in community is our priority. And again, it's not only being in community and trying to educate community, but also listen to them. That's definitely our focus, to listen to what communities are saying. And then, according to what they say, just partner with the information we get, right? So we can actually have a good partnership and not just a conversation, because we're looking for partnership.
What have been some of the concerns that you've heard from the community while you all have been in these diverse communities?
Yeah, well, one of the main, there are a few. So one of those have to do with passing whole. There are a lot of cultures that say that their culture or their religion says that you came whole, so you need to pass whole. And we respect that. But we've also talked a lot with some Native American doctors. We partner with one doctor in North Dakota, Dr. Monica Mayer. She's amazing. And in one of the last events we did with her in Minot, North Dakota, she was telling, Native Americans and other cultures have this conception that you need to pass whole, but it's very unlikely that you actually pass whole, because a lot of the Native American communities, unfortunately, and other diverse communities have a lot of health issues, right? Diabetes, high blood pressure, and you need to take certain medications that change some of internal factors, so you're not passing whole. Or you lose a limb because you're diabetic, you need to get one of your toes amputated. So this conception that you're passing whole, she said, is more kind of a fantasy in a way, but is what a lot of cultures believe, and that's okay. And the other misconception that we hear a lot is that doctors want organs to be transplanted, and they are not going to save the people in the hospital. And what we always tell them is, well, doctors' job is to save your life. They don't know if you're an organ donor or not, and they are not connected to the process of organ donation and transplantation. Hospital is one entity, the transplant centers is another entity. We, LifeSource, have the information about that, but we cannot act until the hospital contacts us. So nobody knows what's going on with that person. So your life is going to be safe first. Then if, unfortunately, you were declared brain dead or have some circulatory arrest and you're not going to survive and you're on ventilated support, then the hospital contact us. But there is no way that a doctor is not going to try to save your life first. That's what they studied for, right? To save lives. So your life is first, and nobody has information about you being a donor or not before you pass away.
I think that really helps reduce stigma and reduce some of the fear that takes place when people realize that they need to enter a hospital or they may need to have extensive treatment.
Yeah.
They don't know what their quality of life will be potentially, or if someone is actually invested in their health and sustaining that overall, or is it just more dollars and cents? So for you to say that doctors have no connection to that process, I think really reinforces that there are options for you to have overall wellness and move forward with a better quality of life overall.
Yeah, and and we understand that mistrust. There is a history of mistrust from certain communities with the medical entities. We know that is part of the history of this country, so we understand that. But we've been working with communities to try to educate them and this is not what's going to happen. I mean, your life is going to try to be saved first.
Right.
And we also try to facilitate conversations. We have a team that is amazing. They are called donation liaisons. But also when people have religious concerns, we always say, hey, most of religions in the world support organ donation. And if you have any questions, please seek guidance with your religious leader. I mean, we're not here to make the decision for you. We're just here to provide information so you have all the facts that you need to make an informed decision.
I think that's very powerful. Now talk to me about how LifeSource utilizes places like OROMIA11, ethnic media, and social media to inform the public, but also minority communities about organ and tissue donation.
Yeah, well, through this conversation, we try to demystify some of the ideas communities, diverse communities especially, have about organ donation. So providing education with an honest conversation about what we do and what we are, and just opening our doors to future conversation and training. We have amazing staff that does work in our social media. So we use representation. We have an amazing group of volunteers that we call ambassadors, and they do a lot of work for us. And we also have the opportunity to work with them in social media. So if there are some more diverse ambassadors, they work with us to record some videos. We have an amazing doctor from Pakistan, Dr. Umar Farouk. And we have a program in TikTok that's called Ask the Surgeon. So he's telling us different things that happen in the organ donation process, and he's been very successful. He's very popular in TikTok. So if we have audience here in OROMIA11 who are listening to this interview who are TikTok users, I would recommend to go and search for Ask the Surgeon with Dr. Farouk. He is such an amazing character, and as a doctor he can explain things way better than I can. So it's been very educational.
Now you said that you guys are on TikTok, but what other social media platforms are you guys on? Are you on Facebook?
We're in Facebook,
Instagram?
Which is a different audience than TikTok, right? Instagram, LinkedIn, and our website that has tons of information available.
Now please provide people with not only the address for LifeSource, but also the web address for them to be able to stay connected to the work you guys are doing.
Sure, yeah. So our website is life-source.org. And our address, physical address,
yes, please,
is in North Minneapolis, is 2225 West River Road, North in Minneapolis. And you can definitely give me a call. My phone number is 612-800-6322.
Share with me what keeps you personally connected to this amazing work.
Well, I'm an immigrant, right? So when I moved to the United States almost 20 years ago, oh my God, it's been a long time, I decided that I wanted to work with communities. So I work in 4 different organizations in very similar capacities, so doing a lot of community education and community outreach. And I'm a former teacher, so to me, educating people is what I really enjoy doing. So having the opportunity and the privilege to work for LifeSource right now, working with communities in community, I think it's just the ideal job. And I've been paid for doing this. I mean, it's like, it cannot get better than that. So, you know, and also the mission and the vision of the organization of giving the gift of life so a human being can have a second chance in life I think is priceless.
Please provide us with the physical address and a phone number, if applicable, for people to stay in contact to the work you guys are doing at LifeSource.
We're located on 2225 West River Road, North in Minneapolis. And you can definitely give me a call. My phone number is 612-800-6322. And I can also give you the website address.
Please.
So that is www.life-source.org.
That's very important. Now, lastly, I just want you to invite people to not only stay connected to the work you guys are doing at LifeSource, but register to get connected with donation and tissue donation of their organs.
Okay. So I'm Paula St. John. I work for LifeSource, which is the organization that manages all the process of organ donation. I'm a community engagement liaison. I work with communities, diverse communities, and I want to invite you to please consider registering as a donor. We need more diverse members to register because the need is very high. There are a lot of diverse members of communities who need an organ transplant. So the need is urgent. Anybody can register. Please don't discourage yourself. Just let the doctors decide that. And if you are going to get your driver license or renew your driver license, that's the easiest way to register, or you can visit our website. So please stay in touch. And if you need more information, just give me a call.
Thank you so much, Paula, for joining me today and talking to not only me, but also viewers about this very, very necessary information and beginning the conversation around taking away the stigma around organ donation and tissue donation.
Yeah, thank you so much, Anna. It's been my pleasure.
Now, unfortunately, that is all the time that we have for today's episode of Community Connections. A very special thank you to Paula for joining me and the amazing team at LifeSource. If something that has been shared today has sparked your interest or has encouraged you to take the step to register for organ donation, we have done our job. As always, I am Anna Orr. This has been Community Connections airing on OROMIA11. I look forward to connecting again with you soon.